Ortiz. I'm going to be taking care of you today. Your lab results show that you have chronic obstructive pulmonary disease. Would you like to know the etiology of this disease?
I'm sorry, doctor. Would you be able to tell me what etiology is?
Yes, sure. Etiology is basically just the cause. It's another word to say the cause of something, or it could be the study of something.
Okay.
So, Mr. Rangel, there are different types of chronic obstructive pulmonary disease, but your symptoms: coughing up sputum, cyanosis, edema, and the dyspnea, which is shortness of breath. Those symptoms are more consistent with chronic bronchitis. Yep. Chronic bronchitis occurs when there has been damage to the bronchial tubes. They become swollen and irritated, which leads to shortness of breath. The bronchial tubes, they have these little hair-like structures called cilia, and these structures, the cilia, it helps move mucus up out of the tubes. But in chronic bronchitis, you no longer have the cilia in your tubes, so it makes it even harder for you to move the mucus up out of your tubes, which causes more coughing, which leads to further irritation of the tubes.
I just can't believe this. What could have caused this?
Well, where do you work?
I work at a steel mill.
Well, that's exactly it. Breathing in fumes on a daily basis will lead to hypersensitivity pneumonia, which is inflammation of these little air spaces inside of the lung. This leads to pulmonary hypertension, which is high blood pressure in the lung arteries. Okay.
So, doctor, are there any genetic factors that could have led to this?
One factor is called alpha-1 antitrypsin deficiency, which is also known as AAT deficiency.
Doctor, I can't breathe.
Oh my gosh. You're experiencing bronchiectasis. This is periodic shortness of breath. They're also known as exacerbations. We're going to get everything under control. Don't you worry.
What happened?
There are a lot of pathogens that make this disease much more complicated than it already is. There's a lot of bacteria, and there are a lot of bacteria and viruses that lead to these exacerbations. A known bacterium is called Haemophilus influenza. A known virus is called the rhinovirus. These exacerbations are associated with a prodromic state. In this state, there's an increased risk of blood clots in your blood vessels.
Was there any good news, doctor?
There are a number of treatments to discuss. There is a medication where you can inhale bronchodilators. They will relax your muscles in your lungs and widen your bronchial tubes for easier breathing. There are also anticholinergic agents which are drugs that will block signals from your brain which cause involuntary muscle movements. There is an antibiotic called tobramycin. And there's therapy such as the administration of diuretics. They are pills which increase the amount of water that is taken out of your body as urine.
Well, is there anything I should steer clear of, doctor?
Steer clear of benzodiazepines.